Vaccine in particular. I'm talking about a lot of things actually. So we'll get to that, but first let's start with a public health update from Dr. Chan.
Great, thank you, Governor, and good afternoon. So a couple of updates in the numbers update, and then some comments about some new quarantine updated recommendations that we have. So in terms of the numbers, we are announcing 706 new people diagnosed with COVID-19 today. 518 of these people tested positive by PCR, and 188 tested positive with antigen testing. In the last week, we continue to average about 750 to 800 new infections per day statewide. This number has been stable for the last several weeks. And currently statewide, there are 6,728 people with active infection. Our test positivity rate is averaging about 7.7% over the last week. This is down from 8.7% last week, so that's some good news. And then statewide, there are currently 270 people hospitalized with COVID-19 across our state. This number is also down, now below 300 for the last 2 or 3 days. Sadly, there are 12 new people we are announcing that have died from COVID-19, bringing the total to 897 total people that have died from COVID-19 during this pandemic. 9 out of those 12 individuals are people associated with long-term care facilities. And in the last week, there have been a total of 70 people that have died from COVID-19 in our state. So we're averaging about 10 people per day dying from COVID-19. In terms of some updated guidance we did release a Health Alert Network message earlier this week to our healthcare providers and public health partners, making the announcement that we are no longer recommending or requiring quarantine after an exposure or travel-related risk factor for people who are fully vaccinated against COVID-19. Now, full vaccination means that someone has received 2 doses of one of the currently available COVID-19 vaccines and is 14 days beyond their second dose. So these individuals who are fully vaccinated are no longer required to quarantine after a close contact exposure or travel-related risk factor. Similarly, we are no longer recommending or requiring quarantine for people who have previously been diagnosed with COVID-19 either through PCR or antigen-based testing in the prior 90 days. Now, this does not apply to people who are clinically diagnosed based on symptoms alone. It does not apply to people who might have had an antibody test looking for antibodies, because antibody testing does not give an indication for when somebody might have been infected. But for somebody that is diagnosed by antigen or PCR-based test with COVID-19 in the prior 90 days, those individuals also are no longer required to quarantine after an exposure or travel-related risk factor. Now, this is not a free pass to travel, nor is it a free pass to relax restrictions, and we continue to recommend against any non-essential travel. In fact, the CDC is currently, or this week, released some additional guidance for international travel, given some of the new circulating variants or strains of the virus that are being seen globally. So there continue to be recommendations around restricting non-essential travel. And people need to continue to follow all the other mitigation guidance, including avoiding social and group gatherings, practicing social distancing, wearing face masks whenever people are out of the home and in public places, and continuing with all the other layers of protection we have recommended. All of this guidance continues to apply to people who might be fully vaccinated or previously infected. Now, the reason for this is because we know that no vaccine is 100%. We're still learning about how long protection lasts after somebody is vaccinated. In fact, vaccine studies are currently being undertaken to try and quantify how effective vaccines are at preventing asymptomatic spread or transmission. And as I mentioned, there are new variants or strains of concern that are circulating globally. And so while we relax the quarantine requirements for certain individuals who are fully vaccinated or previously infected, we continue to need to take a multi-layered approach to preventing spread of COVID-19 and still emphasizing the need for people to avoid non-essential travel, avoid the social and group gatherings, practice social distancing, and wear face masks whenever out of the home and in public places. We're still very much in the midst of this pandemic and need to do everything we can to stop and control spread of this virus. And with that, I will hand things over to the Commissioner. Thanks.
Good afternoon. I'm going to do the vaccine update first and then follow that with our long-term care outbreak update. So to date, 86,275 first doses of vaccine have been distributed in New Hampshire, and 53,432 people have received their first doses of the COVID-19 vaccine. An additional 4,751 people have received their second dose of vaccine. This week, we received an additional 17,175 doses of vaccine, which will be used to continue vaccinating our highest risk healthcare workers, our first responders, and our long-term care facility residents and staff. We expect to receive a similar amount of vaccine next week. More than 30,000 people have registered to receive vaccine at our state-run fixed vaccination sites, and about 15,000 people have been vaccinated at those sites to date. These sites are currently open to high-risk ambulatory care provider and first responders, and as we move into beyond Phase 1A, we will start to let the public know when they're eligible to go to those sites. Between CVS and Walgreens pharmacies, 96 long-term care facility clinics have been completed to date, and more than 12,000 people have been vaccinated through those programs. For long-term care outbreak update, we have 10 outbreaks to close today. Bedford Hills Center, Corville at Bedford, Carlisle Place, the Elm Center, Fairview Senior Living, Green Mountain Treatment Center, Hanover Hill, Lakes Region Community Services, Fairview Home, Mount Prospect Academy, Seacoast Treatment and Stabilization Center, residents at Salem Woods, and Ward Health Rehab and Nursing Center. So those are all closed effective today. 11 new outbreaks to announce: Birch Hill in Manchester, Carriage Hill Assisted Living, Dover Center for Health and Rehab, Greystone Farms, Keene Center, Kendall at Hanover, Lafayette Center, Langdon Place of Nashua, Meredith Bay Colony Club, St. Vincent's Rehab and Nursing, and Summerhill Assisted Living. That's all I have. Thank you.
Terrific. Thank you, Commissioner. So today we're going to use our lovely board here for a little bit of a presentation and to outline the process by which our citizens may register to receive the vaccine as it becomes available with our phased rollout. Here in New Hampshire, we continue to administer vaccines at a higher rate than most states. I think we're currently ranked about 12th on the CDC chart in terms of administration, and as was just outlined, virtually every bit of vaccine that comes into the state within a matter of days is distributed to the hospitals and the long-term care facilities as it has been requested. So I do want to take a moment. We'll take a little bit of a step back and just review the phases that we talked about last week, the 1A, 1B, 2A, 2B phases. So it's a little hard to read, but we're in Phase 1A, as a lot of folks I think know and understand, and those are our high-risk health workers, our first responders, and of course the older adults living in residential care settings where a lot of the outbreaks and really the highest and most vulnerable of our citizens are and have been unfortunately been getting COVID. Over the next couple weeks, we're going to really we're currently in Phase 1A and will remain in 1A. And over the next few weeks, though, we are going to start moving into Phase 1B, which we outlined a little bit earlier. Phase 1B are individuals. Previously, we had identified that it was going to be individuals 75 years or older. And the significant change we're announcing today is per the CDC recommendations. And I think where my understanding, talking to other governors, where most states are going, and I think this makes sense, we're going to move that. If you are 65 years or older, you are now considered not Phase 2A, but you're Phase 1B, and just in a matter of a couple weeks, we're going to outline how you can register to obtain the vaccine. Also, individuals that are medically vulnerable or at significantly higher risk, including, if I may, family caregivers of children that are also medically vulnerable or of high risk. Again, the vaccine is not authorized for children under 16 or under. I should say under 16. So we want to make sure that we're kind of building that shield, building that buffer of protection for those individuals, and any family caregivers of those children also qualify under Phase 1B. Staff and residents at IDD facilities, and then our corrections officers and staff as well. Again, making sure that we're providing that bubble, if you will, that shield for some high-risk individuals. Over in Phase 2A, in the coming months when we get to 2A, again, that will include school and childcare staff. So our teachers really will be added to that, as well as the next round of individuals between 50 and 65 years old. Phase 2B, we really start getting into just an age-based phases at this point, 50 to 64 years old. And then Phase 3A and 3B, again, now we're getting into the under 50 range of individuals that don't have underlying health conditions. So it's really about making sure 1A and 1B, our state's most vulnerable citizens. When you look at individuals 65 and older, or I should say, unfortunately, when you look at the fatalities from COVID-19, the hundreds of individuals we have lost in New Hampshire, about 95% of them are 65 years old and older. So our hope is, and the importance of what we're discussing today is, as we get through 1A and hopefully we can get through Phase 1B in the coming months, that really helps protect 95% of those individuals that are of the highest risk and unfortunately have been the victims, really, of the COVID-19 pandemic. So let's go to the next slide if we could. So Phase 1A, again, high-risk health workers. We talked about this a little bit, about 110,000 people within this population. 56,000 have now received their first shot already. We've received about 86,000 doses of the vaccine, so we are really moving it out as fast as the federal government can give us. I think our team is doing a great job. Perry Plummer has come in and really helped manage a lot of this process on the vaccine side, and I think they've been doing a tremendous job. A lot of help from our hospitals, and that makes it available to our first responders, and of course the more federally driven program with the partners, the federal government and CVS. We give them all the vaccine they need to distribute it to the long-term care facilities. And they've all been signed up, they're all registered, and CVS is kind of going through that process, and it looks like they'll be able to meet the schedule that we originally laid out to get folks both their first and second shot. So we'll be in Phase 1A, ongoing through the end of February, maybe even in a little into early March possibly, but the good news is that we're on schedule to take care of our most vulnerable individuals. As we go into Phase 1B, let's bring that up. This population size is a little larger. It's about 300,000 individuals. We have about 1.35 million people in this state. So you're talking about just under 25% of the state or so will make up Phase 1B. It's a large population, so we want to make sure we have a system in place to make it simple, to make it easy and effective for individuals to get their vaccination. So, of course, we discussed the medically vulnerable at a significant risk and those family caregivers. And again, those will be individuals that have at least two of the medical conditions identified by the CDC of being of high risk. It could be cancer, it could be COPD, things of that nature. We have the staff and residents of the IDD facilities, corrections officers and staff, populations that experience health disparities. So we talk a lot about, we have populations all across New Hampshire, but primarily, frankly, in our inner cities that just don't get the same access to health care as many other folks do. So we've set aside a portion of our vaccine, and we'll talk a little bit about how that's going to roll out, but that will be starting at the end of January as well as part of Phase 1B. And then, of course, kind of this new change is making sure that individuals over 65 and older, I should say, can start getting their vaccinations. So, how are we going to do it, right? So what's the next step? We've really worked hard to put, and we're putting a lot of pressure on the team, and I think they're doing a phenomenal job to make sure that we are going to be prepared. Everything we discussed today is how to sign up and how to register. If you're part of that 1B population, how do I register to get my vaccine? The most important thing I want folks to take away is, first off, the registration is not open today. It'll be open on January 22nd. The reason is that as we kind of finalize and make sure the system is up and running, doctors and some of the medical providers are going to be part of this process. We've really simplified it. We've made it very, very simple, but we just want to make sure that we get all the information out, and when folks go onto the website as beginning on January 22nd, with vaccinations starting themselves actually on the 26th. So let's talk about the first group of individuals. You're 65 and up. Anyone 65 and older can now get a vaccination as part of Group 1B. So identify yourself as more than 65. Hopefully everyone knows that. You're simply going to go to our registration website. It's called vaccines.nh.gov, and we'll put up the website a couple times over the process here. And you're going to register for an appointment online. So you go right on there, you register for your appointment. You'll then receive a confirmation email back that will allow you with a link to pick your location and your time. So I register, I get a confirmation email back. I use the link. I just pick my location and time. You go to another website that gives you where you're going to get it, what time works best for you, and then you show up. And you just make sure you show up with some sort of proof of ID, with your birth date or whatever it might be, to ensure that you're 65 and over, and that's it. We're really trying to make it that simple, and that's the vast majority of folks within that 300,000 population of 1B. We've really tried to narrow it down to that simplicity. So on January 22nd, you can go to vaccines.nh.gov, follow the instructions to register, and you're off and running. So there's another population here that we talk a lot about, which we consider the medically vulnerable, or individuals that have medical conditions that put them at significant risk. They may be under 65, but they have other conditions that put them at significant risk for the vaccine. Also, family caregivers of kids that also might have these vulnerabilities. So the first thing we're going to ask you to do is simply pick up the phone and call your doctor. Contact your doctor, and you're going to receive, you could call it a referral or just some sort of certification, if you will, from your doctor that confirms that you do have a couple of these conditions that have been outlined. And then either going directly through your doctor, or your doctor will notify the state, and you'll receive one of those emails to pick your location and pick your time, and you're off and running. So it's just adding that one extra step, very simple, of calling the doctor. The doctor confirms that you have the conditions, and then you're off and running in the system where you're picking a location, picking a time, and receiving the vaccine at your convenience. The other groups that we talk about are corrections staff. So these are folks that might be working in our state prisons or in our county jails. Our local public health networks will directly contact those facilities to make sure that they schedule and allow access to those individuals who come under this category of correction staff in Phase 1B. And so the public health network will proactively reach out to those folks, as well as individuals that might have intellectual or developmental disabilities and residing in a congregate setting, and the staff in those settings. They'll be contacted as well by the public health networks to, again, schedule a time when they can come in and or someone can come in and provide the vaccination. Again, probably sometime in the February to March timeframe there for the first vaccinations, but they'll be scheduled obviously in just the coming weeks and months here. And then finally, we talk about the disproportionately impacted populations. These are folks who, for a variety of different reasons, just don't have the ease of access to health care that a lot of folks have. Sometimes it could be a language barrier. It could be a variety of different things. Predominantly, you see this disproportionately affected population in our small cities of Manchester or Concord or Nashua, but it could be anywhere across the state. So we've already started this process, really. We've done training and outreach. That is well underway. We've done training for, I think, well over 100 individuals, really getting that messaging campaign out there, how to access it, the safety of the vaccine, what individuals need to know to understand it and feel comfortable about getting the vaccine. The regional public health networks are coordinating all of this, and we'll be distributing through mobile vaccination clinics. That's how we're going to start this process. Again, primarily in the Manchester, Concord, and Nashua area. And that vaccination process will begin on or about January 26th. So that process is well underway, and again, just really making sure that no one is left behind in this entire process. So these are just, I guess, just to kind of sum up a little bit. Appointment registrations will open on January 22nd. That is next Friday, I think, correct? Yep, I have that correct. So in about 8 days, you'll be able to go onto the website, vaccine.nh.gov. And then, of course, if you have questions, our 211 hotline is being staffed up. I'm sure there's going to be a lot of questions. We ask folks to be patient. Please be patient as much as you can. You can always go to our nh.gov/COVID-19. That's been our website, our centralized website for lots of different pieces of information. But again, patience is going to be key. We can only distribute it and sign folks up as we know the vaccine is coming in. So right now, on average, we might get 17 or 18,000 vials of vaccine. So we have confidence that number won't go down. We've been promised it will go up. But one thing I've learned from the federal government is don't bank on that 110%. So as more vaccine becomes available, more spots to register yourself for the vaccine will become available within our system. We don't want to basically overpromise and underdeliver. So our system, we'll have enough spots to sign up as we're assured that vaccine will be coming in over the next couple months. And then as more vaccine, if they start ramping up production for us, that would be great. We'll be able to add more vaccine in. So we want folks to be patient. You could go on January 22nd, 23rd and register, and you might get pushed out 2, 3, 5, 6 weeks because we can only register those for the amount of vaccine that we know we're coming in. Again, the team's done a great job moving it out. I feel I have a lot of confidence in seeing what has happened in these first few weeks, that the team can absolutely perform, get these, whether it's through fixed sites or other opportunities, make sure that the locations are distributing and administering the vaccine as anticipated. So I think hopefully this is good news. We know there's going to be a lot of questions. We've really opened up for about 300,000 people now to be part of that Phase 1B vaccination process, if they so choose. There's no mandate here, of course, if they so choose to do it. And in the next week or so, they can go onto the website and start the process, or if need be, just pick up the phone and call your doctor if you qualify as part of the medically vulnerable population. One last thing I want to talk about a little off of the topic of vaccines, just because obviously the last couple of weeks has it's had a lot of news. Just put it that way, both locally and nationally. There's just been so much going on. So I do want to give a brief update on the potential, frankly, for civil unrest, both here in New Hampshire and across the country. It's something that has, I think, glued a lot of us to the news channels and to the television to see what's happening out there as not just the inauguration of President-elect Biden comes up, but also some of the threats that we've heard locally as well. And so as the FBI has warned, states should be prepared for protests and potential threats at all 50 state capitals starting this weekend through the inauguration of President-elect Joe Biden. I've been assured by our New Hampshire Department of Safety that we are prepared to ensure that any protesters are able to freely express their right to demonstrate, provided obviously that they're safe and they comply with state and local guidelines. State officials are constantly communicating with our federal and our local partners to review all the intelligence and to understand the potential impacts on New Hampshire and obviously plan accordingly for whatever information may be out there. We will have our National Guard on standby to be deployed if needed, but we feel very confident that if anything should arise, our team has always done an exceptional job of handling any potential unrest, and we don't expect anything to be different as we move forward. So with that, we can open it up for questions. Oh, and there's the website there, vaccine.nh.gov, January 22nd. That's when you can go there.
Governor, how does someone register if they don't have internet access?
So you can call. So two things: if you're medically vulnerable, you would call your doctor to be referred as part of and the doctor can essentially sign you up. If you don't have internet access, you could use the 211 hotline, and they could potentially help again get you access to the system.
Will somebody call them back? I guess, is that just they're gonna be connected with help, or?
Yeah, so if you're 65 and over, right, that's the population that we're talking about. If you're 65 and over, it's just a matter of registering. You're kind of self-attesting that you're over 65, and you bring proof of that when you show up. You might bring your driver's license or whatever it might be. So if you don't have a loved one or caregiver or whatever that can get you internet access, again, via the phone, someone can help you sign up. But you still have to show proof that you are over 65 when you show up for the vaccination.
But as you know, we're an older state, Governor. And as Commissioner Shibinette pointed out, 17,000 vaccines. So what if you're approaching this point of 65? What if, this is the middle of March, you're going to be 65, and and I might not get an appointment for 6 weeks when I reach out and try and get one.
Yeah.
So do I wait till after my 65th and call in? Do I?
No,
what would you suggest?
As soon as you turn 65, you can go onto the website and register. Yeah, that's probably the best thing I could recommend. And again, we are asking folks to be patient. My guess is you're not going to get necessarily an appointment for the next day or maybe even the next week. There'll be a lot of demand out there, as is practically understood. But we think, again, if 18,000 vials are coming in, minimum over the next 10 weeks. That's a lot of opportunity for folks. It doesn't quite get us to the full 300,000. We also have to finish out our long-term care. We're going to have second doses coming in. We've heard a lot of very positive talk from Washington that they are sending more. And I had a call with both the Vice President and Alex Azar earlier, Secretary Azar earlier this week. And we heard a lot of positive things. I'll just keep saying that more is coming. Again, I don't want to say I'm doubting it, other than to say I think we all we'll believe it when we see it, and then we will have a system that can adjust accordingly. We just always want to make sure we're meeting the expectations of the population.
Governor, if you've got somebody who's over 65 but is within that 3-month window of having had COVID and the antibodies, can they sign up? Can they get the vaccine if they're still within that 90-day period?
It's a great question. I believe so. Yeah. Oh, yeah, sure. Dr. Shin.
Yeah, it's a good question. The short answer is yes. People cannot get the vaccine if they are still supposed to be on isolation due to infection. But once they're off isolation, they can get the vaccine at any point once they're not infectious anymore. The only caveat to that is that if somebody has gotten one of these therapies, one of the monoclonal antibody treatments, there is the caveat that people who have gotten this therapy, the monoclonal antibodies, shouldn't get the vaccine within 90 days. So there's sort of two groups here. One is, people with COVID-19 can still get the vaccine as long as they're not on isolation. If somebody has gotten one of these medical therapies, the monoclonal antibody therapies that are out there, then they have to wait a full 90 days.
Governor, regarding the protests, are you aware of any specific threats? And overall, where's your concern that something similar that what we saw at the U.S. Capitol could happen here in New Hampshire?
So I can't discuss of anything too specific, other than to say we're very prepared and can handle anything that would connect to any of the intelligence that we do have. I'm always very concerned. I would never sit back and say that what happened in Washington can't happen here. It can happen anywhere. And so we're going to be prepared for that. So for that contingency, if God forbid it should happen. But, I think protesting is fine. Having a voice is absolutely fine. State House grounds are there. They're open. And, if folks want to come up and have a voice, that's absolutely the right place and the right time to do it, provided that they're safe and they're following the guidelines and regulations of safety that we expect from folks.
Given the fact that Granite Staters can carry guns, does that heighten the level of concern? Or
No.
No. You feel like people can be responsible?
They always have been, yeah, for the most part, with very few exceptions, but yeah, that's not an issue. Sorry, Adam, did you have one?
Yeah. I kind of forgot. Sorry.
That's okay. We'll come back. We'll come back. I do it all the time. Sometimes I forget the answer, right? You just forget the question. It's okay.
Really good. I'll keep working on it.
We've heard from some medical providers at some of the Zoom meetings about the medically vulnerable population. Some clinicians and you've got that separate referral there. Is that going to be time consuming? We did hear this from
Can you
folks.
go back to
They're
the
gonna
slide?
have-
Yeah, just to
that'd be
make sure.
great.
Yeah.
In other words, we've heard from some doctors, am I going to have to
The 1B process.
consult charts, in
Sure.
order to confirm this, or is all this
Yeah.
already on an automatic medical record?
No, the next one for the medically vulnerable. There you go. So if you are medically vulnerable, again, you have to have two of these conditions, and the conditions are fairly severe. My guess is you wouldn't necessarily have these conditions without your doctor potentially knowing about it or easily identifiable. So yeah, it's just like if you were. It's similar to a referral, frankly. If you're going to get blood work or something, your doctor wants to make sure that maybe a prescription that you're getting, the medicine isn't going to conflict with anything that you might have. So yeah, it might require folks working or checking your chart or your file. The population here, this is a ballpark number, 80, 90,000 individuals potentially, something like that. That's a very rough guess, please. So. Again, it may take a few weeks to work through that process, and I understand that there could be a lot of folks calling their doctors, and again, I appreciate, the doctors will have to do a little bit of extra work here. But if it means getting someone who's medically vulnerable to the front of the line, someone that has cancer and COPD and should be in the front of the line, then yeah, check the chart, make sure they're there, and then it's that simple. You sign up and you go. It's just a confirmation from your doctor. And again, doctors have a lot of flexibility. We're not keeping them just in this very tight box. They will have a lot of flexibility with making that determination on behalf of their patients. So even if something technically isn't on the list, or they feel as their doctor that someone is of a severe condition and a severe risk, I should say, for COVID, doctors have the discretion to allow the process to move forward for those that do have medical conditions.
Got my notes straightened out this time. How do you respond to this criticism that's arose over members of Ski Patrol being able to go before teachers?
Ski Patrol are providing emergency medical services. They're essentially providing frontline medical services like an EMT. A lot of them are EMTs. So teachers don't provide emergency medical services, and aren't required to. So it's like a school nurse. They get to go earlier too if they're potentially providing emergency medical services, regardless of what your job title is. Those are the folks that we vaccinate. Yeah, because those are the ones that may have to rush in and take care of someone that is very vulnerable. Yeah.
Do we have a status update on the Valley Street Jail, as far as how that's going, how many cases?
In terms of number of cases, I don't know if the commissioner has.
So, Hillsborough County House of Corrections with 104 resident cases and 24 staff cases. New Hampshire Department of Health and Human Service Public Health is now working with the Hillsborough County House of Corrections twice a week on site to provide them in-person guidance and consultation to help trend down their outbreak right now. So very active in that outbreak.
Commissioner, while we have you up there,
Sure.
do you mind commenting on, I know we had talked about a couple weeks ago about the rate of rejection among healthcare workers. Has that improved at all? What's the status right now?
It has improved, and I think what we're seeing is there are people, no matter what the new treatment or the new technology, where people are upfront saying yes, I will take this, and then there's laggards, right? That will say I'm going to watch my coworkers take it, and if they're okay, then I'm going to take it. And that's what we're seeing now is healthcare workers that may have been ambivalent or hesitant in the first week or two are now stepping up at further clinics and saying, okay, I want to get it now. So we are seeing that rate of acceptance going up in the healthcare field. Yes.
Do we have some questions on the phone?
Sure, Governor, we do. Our first question comes from Holly Raymer with the Associated Press. Holly, please go ahead with your question.
Hi, thanks. Following up on the earlier questions about the process when we're in the next phase, healthcare providers, primary care doctors, and others also expressed concern about just, having enough of a workforce to handle all of these calls and verifying that people meet the eligibility, and they're concerned about just all the hours that will take. Is there any plan to use to provide any extra funding to those providers to cover those kind of costs?
No. Look, are we asking folks to call their doctor, someone just to confirm that you have two of the very severe medical conditions? Yes, a lot of those will be immediately confirmed because they can. I don't know many folks who have cancer or going through cancer treatment and their doctor doesn't immediately know about it. So a lot of it will be pretty easy, frankly. There could be patients, I suppose, that doctors don't know as well, and they have to go through and look through a chart. And yeah, I suppose that could take a little extra time, but look, we're talking about the biggest public health crisis in the state's history. And if over the next few weeks, doctors have to spend a little extra time going through and just double checking that those that are most medically vulnerable are first in line, as they should be, I think that's a very appropriate system, and it's actually a very simple system. And all they do is say, yep, they check the box and they put them in the system to get registered. I can't think of anything simpler. If to do it the other way, you're essentially opening it up to everybody in the state. If there's no verification if we're saying that those that are most medically vulnerable should be going first, but there's no way to verify any of that. There's no checks and balances on that system. The risk is that everybody piles in, they self-attest to whatever they want, and those that are most medically vulnerable, because of the limitation of vaccine from the federal government, are pushed to the back of the line. That's not fair. That's not right. That's not going to get our fatalities and our risk level down the way it should be. So, of course, yeah, we're asking, look, everyone's putting in some extra hours here. Everybody is. And, I appreciate, I appreciate that. I guess there could be doctors with, a few hundred phone calls over the next couple weeks. And, it's going to be a little extra work. I totally get it. I appreciate it. And yes, we're asking them to do that work on behalf of their patients, on behalf of those who need to go first, who need their lives protected because they are so vulnerable. And we've seen the fatality rate so high for those individuals that can be medically vulnerable.
The next question comes from Paul Hayes with a Caledonian Record. Paul, please go ahead with your question.
Hi, we're coming up on MLK Day, and I just wondered if you could point to any specific examples of progress against Minneapolis.
I'm sorry, examples of progress concerning social and cultural diversity, concerning what we're doing with our LEAC Commission and law enforcement in particular, because you mentioned Minneapolis, so I just want to make sure I'm answering your question appropriately.
Right. I mean, social justice causes in general. I know the police commission's one, but if you could sort of point to some other aspects of making progress in those general areas.
Well, I got to say, our LEAC Commission, the Law Enforcement Accountability Commission, was without a doubt the most progressive you're going to find and one of the best managed processes you're going to find across the country. The fact that we did it with such speed, we did it with such inclusion from law enforcement to the to those asking for and demanding and rightly expecting some sense of balance in the system, some more, you'll call it social justice in the system, some more accountability with law enforcement, whatever it might be, and the fact that we put forward so many recommendations, all of which were unanimous amongst that group, and all of which, I mean, I could go through and start listing every single piece of that, but there was so much there. It touched local law enforcement, it touched our judicial system, it touched our Department of Safety, all aspects of it. It touched our parts of our cultural aspects of our community, diversity we want to see simply within our communities themselves. So that commission was really all-encompassing, which is why I think it did such a phenomenal job. So I don't mean to be give you the brevity of the answer other than to say all the different recommendations built into that I think were tremendous. And then just raising that heightened awareness for all of us within the Department of Justice, within our schools, whatever it might be, that we have to take our discussion to the next level. We have to have an understanding of it. We have to make sure all sides have a viewpoint. We're not all going to agree on every viewpoint and every action item going forward. But the fact that so much of what we're moving forward with is unanimous in agreement. A lot of it is legislatively driven. Some of it's executive order driven. Some of it is just recommendations and funding will be put forth in the community. So there is a lot of meat on the bone, so to say, and that's just the first step, right? And the whole point is let's start getting some of that wind under our wings, and then we'll make it a living, breathing document. We'll revisit it again in 6 months or a year or whatever it might be. See what worked, see what didn't. Maybe put some new stuff on the table. But I think New Hampshire's taken some very progressive and appropriate steps in all manners of that issue.
And the next question comes from Nancy West with In-Depth New Hampshire. Nancy, please go ahead with your question.
Yeah, good afternoon, Governor. I have a couple of questions. I understand that you have to mute each questioner after they're done asking the question, so I'll ask them all up front.
Sure.
And unfortunately, Paula Tracy, who does such a great job covering the press conferences, is unavailable today, so
okay.
I'll just try to choose for a bit.
Give me what you got. I'll write them down as you go. I'll write them down. Go ahead.
I should have written them down. Let's see. I hear from the folks in Co-op County that they're concerned because they have to drive such a distance, even the first responders, to get the vaccination. There are no vaccination sites, the emergency vaccination sites in Co-op County. Is that going to continue when the bars change so that people 65 and older can get it? And also, do we have a shortage of vaccines? I mean, if we had more vaccines, could people be vaccinated quicker? What could speed up the process of getting more vaccines more quickly to New Hampshire? I think the other thing folks in the Co-op County region were concerned about is the lack of communication. Even the people who are part of their COVID team, their response team in the Berlin area, have no idea, no clue what to expect in the coming days, weeks, and months. And I'm also wondering if the doctors will be told what is now expected of them. And also, I'd like to get back to the teachers for a minute. Perhaps teachers, luckily, will not be providing medical care, hopefully, to students, but they have very close contact. So why are they, so far down the ladder on getting the vaccine when I think a lot of families and a lot of teachers would feel a lot more confident about keeping all the schools and getting all the schools reopened if the teachers were able to get the vaccine sooner. Last question. If the amount of vaccine remains at what you suspect, or I know it's nice to hope for more, but around 18,000 doses a week, how long will it take to vaccinate everyone who should get a vaccination, people I guess 16 and older? How long will it take? What are we talking, late next summer?
Okay. Nancy came ready. Here we go. So I wrote down as fast as I could, and I will do my best. Concerns in Coos County about the distance that some of the first responders are having to travel to get the vaccine. Again, Group 1A was our highest risk population as well as first responders. We opened up about six fixed sites across the state, where we have those open now.
We're adding another one.
And we'll be adding more. So the quick answer to your question is yes. As we expand the populations that will need vaccination, we'll be expanding our fixed sites as well. There may be some hospitals that open their own fixed sites. So it's really a function of the amount of vaccine we're receiving and the availability. So as we go into 1B, as we're really expanding that to another 300,000 individuals, we will definitely be expanding the number of sites across the state to make it easier and more accessible, of course. So do we have a shortage of vaccine? We use every bit of vaccine that comes in, goes right out. We really don't hold on to any of it, other than maybe a day or so just to get it to where it needs to be if it were to come to the state. Most of the vaccine actually is shipped directly to either CVS and Walgreens for our long-term care facilities or the hospitals directly in the future. So the shipment and logistics actually work very well. The federal government simply provides us our pro rata share, pretty much equal to every other state. So every state really gets about the same amount based on their population, and we get that out as fast as we can. And again, we're, I think, ranked 12th as of today. That can move up and down for any number of reasons, but I think we're ranked 12th in the country in terms of getting it out quickly. And that's administration. That's actually shots in arms. Distribution, we've distributed almost everything. Shots in arms, I think we're ranked 12th. So we'll keep, that's a good marker, but we want to keep it up. We'd always love to see things go a little faster if we could, but the main 90% of our limiting factor is simply what the federal government is providing to us. So the third question was a lack of communication in terms of what to expect in the coming days and weeks. I just gave you 20 minutes of exactly what to expect, exactly who will be in the phases, and exactly what to do as a citizen if you qualify as one of those phases, from who to call or what website to visit, what you can expect and why, the dates, the times, the emails that when folks register into the system, they'll get a confirmation email that'll take them directly to a site where they pick their location and they pick their time based on availability. So that's it. We're really trying to make things very simple. I think we'll also be getting, between now and the 22nd, we'll keep communicating with doctors, making sure they get their health alerts notifications in terms of, is that health alert notification? Is that what the HAN is? In terms of what is expected on their end, if they have any questions, who to contact, how to make these certifications or referrals, if you will, into the system and allow folks to just have access that are medically vulnerable. So we'll continue to talk with them and work with them. And again, we have, that's why you won't be able to register really for another week. We want to make sure we dot the I's and cross the T's and make sure everyone's ready to go and we can meet the expectations of our citizens. Teachers, look, I appreciate that teachers are in close contact with kids, but getting the vaccine right now has to be about those that are of the highest risk of fatality, those that are of the highest risk of being put in a hospital, and those that care for those that are of highest risk of having a fatality or being in the hospital because of COVID. And so that's this first 400,000 individuals. By all means, if a teacher's meets any of the medical conditions. If a teacher is over 65, they're in it just like everybody else. But this all has to be about lowering the death rate and managing the hospitalization rate. Teachers, other than healthcare workers, are really the only other workforce that has been outlined and identified as having a specific place in the process. We got letters and requests from virtually every industry you can imagine, from the radio broadcasters to the meat packers, everyone making a case why they should be first. And I appreciate all of that, I really do. But, you know, for all, and so I'm going to go broader than the teachers, if I may. Let's take folks that work in a grocery store. They come in contact with people all the time. We appreciate that. It's not the worker in the grocery store per se, the healthy 40-year-old worker working in the grocery store. It's not them that has to be prioritized today. It might, but it's their parents, or it's their loved one or neighbor that has a medical condition. They have to come before that worker. And then we'll get to that worker, just like me, you know, fairly healthy, 46 years old. I had to actually look up the other day that I was 46. I keep saying I'm 47. I'm still 46 apparently. And there'll be a time for my demographic as well. So we know a lot of industries come in contact with individuals, whether it's teachers or otherwise. But we have to put those individuals of highest risk even before them. That only makes logical sense. So I appreciate, you know, no one wants to get schools open. I think pretty much every school can be open across the state without a doubt and safely. And I'm very frustrated that there's a lot of pushback from folks. I know the teachers union has been very clear. They don't want to open certain schools. I think is an absolute disservice to kids. And I think that's why Democrats and Republicans alike, I don't care what your party affiliation is, parents across this state are begging for schools to open up, and they should be open. But again, it's not the teachers per se. It's making sure that those that are most vulnerable, those that are of the highest risk, get to go first. That's frankly only fair, and that's what this managing this crisis is all about. And what do we do if the vaccine amount doesn't change? If we're only getting, I'm going to round a number, ballpark 20,000 vials of vaccine a week. Into perpetuity, yeah, we'll get it out as fast as we can. We're going to stick to our prioritization, and we'll work through that prioritization as fast as we can. But sure, it would take a long time to get through 1.35 million people. Now, we know not everybody would take it. Maybe you'd get 70%, 75%. That's a ballpark number of individuals across the state that might want the vaccine, maybe less. So you're still talking about having to vaccinate 600,000 or 700,000, 800,000 people, and at 20,000 vials a week, knowing that everyone needs, at least for these first initials, 2 doses. That would take quite some time. But the most important part is those, I'm going to say it I don't mean to be ad nauseum about it, the 400,000 people that we are talking about in Phase 1A, Phase 1B, that make up the demographics that comprise 95% of the fatalities. Teachers in themselves don't make up 95% of the fatalities. Grocery store workers in themselves don't make up 95% of the fatalities. 65 and over, that's 95% of the fatalities. And that's why, as fast as the federal government will give it to us, we're going to put those needles in arms, and that's why those folks have to come first. And when that happens, when those first 400,000 individuals have their first and second dose of the vaccine, I don't know how you wouldn't see a massive drop in hospitalization, a massive drop in fatalities. That's only the next logical step, unless the virus were to mutate again or something like that. But we feel very, very confident this is the right way to go, and this is exactly how we get out of this situation faster. And that's what it's all about at this point. We know there's that light at the end of the tunnel. We want to get out as fast as we possibly can. Okay, I think I got all 5 there.
One more.
Okay, let's do it.
All right.
You bet.
Our next question comes from Jordan Haim at New Hampshire Public Radio. Jordan, please go ahead with your question.
Yeah, I was wondering if the state is going to be taking any actions against the Webster Rye this nursing facility that prioritized board members alongside frontline healthcare workers and residents. Is there any plan for addressing things like this that happen? They may happen at other facilities to make sure it doesn't happen again in the future.
No, the state has no plans to take action against that individual facility. I think we all were pretty shocked when we heard that they had put individuals ahead of other folks that probably shouldn't have been prioritized as part of the vaccination, and we just hope it serves as an example to other facilities across the state. They gotta play by the rules like everyone else. It seems to have been an isolated incident, and we hope that it remains that way.
We're all set on the phones, Governor.
Can we hear from Dr. Chan about whether or not we've seen any of the new variants of COVID pop up yet here in New Hampshire?
Yeah, thanks for that question. Questions about the new variants or circulating strains of the novel coronavirus. And the short answer is no. We have not identified yet any of these new emerging variants of concern that are being seen in other places of the world, like the UK and South Africa, Brazil, and also now identified in other places within the United States. I will say that there's an expectation that, as with any virus that circulates, is going to be a certain rate of change or mutation in the virus. And I think what has been seen with some of these variants are that there are more mutations that has led to some concern about these strains being more infectious or more transmissible, more easily spread between people. There are efforts underway, not only in New Hampshire, but also nationally, to increase the genetic sequencing of positive specimens that we have to try and identify if and when we have any of these variants identified in New Hampshire. And so our public health lab is currently working to try and increase the amount of genetic testing that we're doing on some of these strains, but we haven't identified it yet, and certainly we will, you'll be hearing more about it if and when we do. Thanks.
Governor, regarding the potential protest, last one, as for neighbors of the State House, businesses, residents nearby, have you had any sort of communication with them? If so, what's been your message?
I haven't had direct communication, but I know the Department of Safety doesn't just take the State House individually. Obviously, there are other potential targets in the state, and they're looking at that as well. And obviously communicating, to make sure that their presence is known and can answer any questions amongst the community. But I really leave that to the Department of Safety and the National Guard.
Okay.
Governor, do you have a sense of the breakdown of, in Phase 1B, how many people will be getting their shot from a primary care physician versus fixed locations? And I guess, is there a ballpark sense of how that's going to be distributed?
The question is, what ballpark percentage of how much will be, where folks will essentially be getting? I think the majority will likely come from most of these fixed sites. I think that'll be the easiest way to do it, or maybe a hospital. But I don't know because the way the vaccine comes in, we get for example, I think is it Pfizer that we get about 1,000, about 900 in a shipment at once. So to take that and then to break it up and just to send 5 doses to Dr. Smith and 5 doses to Dr. Jones, that becomes difficult, which is, and people would have to make appointments and go in to see their doctor and all that, as opposed to one of our fixed sites where we're just tearing them out a lot faster. So to get the throughput we want to see, we'll really try to push people to either hospitals who might have their own system set up or our fixed sites, a variety of different options for folks, but all of which are designed for fast throughput.
And who's going to decide when a certain phase is done? I understand that you're going to move on at a certain point. It probably won't be 100% finished. So where do you draw that line?
There's no line, really. That's a great question. So when are we done Phase 1A? We're really not, because technically maybe someone will go into a long-term care facility in May or March or April, and then they become available for the vaccine. So the bulk of the fixed residents that we have now, or the medical staff that we have now that are receiving their vaccine, that's there, and we'll take care of the vast majority. And then it'll be an ongoing process, and it'll be kind of a maintenance as opposed to the initial and the booster shot. So no, they don't really end. But they'll obviously, most of the folks eventually, as we enter March, will be primarily in the 1B group. There could be still some 1As. Maybe some folks decide not to get the vaccine today. That's okay, even though they're up. Maybe they choose to do it 2 months from now. They can absolutely do that. Even if they're in Phase 1A today, the door doesn't shut on them tomorrow.
But we had folks up this week who operate performing arts centers that said, we've got ticketing systems. We could do this. In other words, we could be a fixed site to deliver vaccine for the state as this thing ramps up further and further. I'm sure you've seen Dodger Stadium now. They're going to use, give as many as 12,000. Yeah. Gillette Stadium is going to be a site. Is that an option here going down the road, actually going a vaccination site system that goes beyond the fixed site?
Absolutely, yeah. Look, we've talked about how to open up a massive vaccination site. I think, is Massachusetts using Gillette Stadium maybe? Right now we get about 17,000, 18,000 doses a week. You could probably move almost that much through in a couple days at one of those mass sites. That'd be a single site here. So we don't really get enough vaccine to ramp up to that level yet, but we have that contingency it's on the table, and we could open it up as a possibility. And it would be a great option, frankly, if we started rolling in 50, 60, 100,000 vials a week, something like that. Having a giant site that can just really churn it out, that's always on the table.
Do you believe Congress did the right thing by impeaching President Trump?
You mean in terms of their congressional vote? You know, I was pretty clear, you know, when it comes to the actual, just to take a step back, when it comes to what happened on Wednesday, or a week ago Wednesday. And I really do believe, and I think most people would agree, that the president's words really incited on the unfortunate actions that took place following that. I got to be frank, I'm not trying to be dismissive of it, but Congress, I'm going to kind of defer to Congress to make those decisions. We got so much on our plate right now. I don't have a say in that process. I don't have input in that process. I'm trying to manage vaccines. I'm trying to manage a budget. I'm trying to manage COVID. We got a lot on our plate. Frankly, it'd probably be a disservice to the citizens of the state if I started focusing on Washington, D.C. and not what's really at home. So I'll leave it there. Okay? Great. All right. Well, thanks, everyone. Again, we'll be back next week. We'll be. I think we'll have some more information, answer some more questions, and clearly the team here in the state of New Hampshire has done a phenomenal job moving the vaccine out. We have a plan. We want citizens to know what to do when. This information will all be that we presented today will all be available on our website. So feel free to go and kind of review. Again, the vaccines.nh.gov, that'll be up and running on January 22nd for those that are in Phase 1B. We are going to have as many available slots as vaccine that we're going to get. And as the federal government gives us more, we'll open up more of those time slots and make it more available. So we ask folks to be patient. We've tried to make it as simple of a process as we possibly can, just to allow that throughput to happen and we all get through this COVID pandemic as fast as we can. So thank you guys so much for joining us.